terve kaikki. Minulla on tänään kunnia täällä olla vieraana Chad Brandtin, joka on kliininen. Hän halusi, että mä käytän tätä sanaa kliininen psykoterapeutti, ja hän on Houstonissa. Can you? Yeah, I'm gonna switch over to English and ask you a question here. Keep it easy like this. So it's the McLean. How do you say McLean Institute?
Yes,
McLean. Okay.
OCD
Yeah.
Institute of Houston.
All right. Ja hän on switching back again. Hän on erikoistunut varsinkin, hän on käyttänyt Bergenin mallia, itse asiassa yksi ensimmäisiä maailmassa niin kuin Norjan ulkopuolella, ja sitten hän keskittyy varsinkin ihmisiä, joilla on tosi hankala tai jotenkin niin kuin erikoinen, jos voi käyttää ehkä sanaa aggressiivinen OCD. I was just explaining the word severe in Finnish, so that's your. So do you want to carry on from that? I was just explaining that you're dealing mostly with people who have a severe. Yeah, sure.
Yes.
So
absolutely.
hello as well.
Hello, yes. Hello indeed. Hello to everybody watching. I hope the translation to Finnish goes well, because I couldn't learn the entire language before we agreed to talk.
No, it's fine.
Yeah,
it's up to me to do the translation correctly.
Right.
So yeah.
So I'm a clinical psychologist in Houston, Texas, and I specialize in severe to extreme cases of OCD. So I'll work with children, adolescents, and adults through any age range, any family dynamic system, just helping people who are really, really, really stuck, or families who are really stuck in OCD, find a way out and find a way to get back to their lives.
Yeah. Can I ask a short one? That how did you end up being a therapist, or how did you end up to concentrate on people who are dealing with OCD and those kinds of mental health issues or challenges?
When I started my PhD in America, we mostly do research degrees. So you learn to be a therapist, but you produce research papers and do all of that. And I did something that we call me-search in the field, which is where you research things that affect you. And I was born with a lot of anxiety. I'm an anxious person. I don't have OCD, but I had a lot of anxiety. So I started to research anxiety. I worked with people with anxiety and substance use issues. I worked with people with anxiety and health conditions like HIV and AIDS. And I worked with veterans, so like trauma, anxiety issues.
Yeah.
And when it came time for me to get out of school and go into the private practice field, I had some OCD experience, and I really enjoyed it, and I really wanted more. And there was an opening at this clinic where I could use all of my anxiety experience and grow and learn about OCD too. So I got into a position here about 3 years ago, and OCD is pretty much all I do, all day, every day now.
Yeah, important work, I can say. So thank you, thank you a lot. Then to the next tricky question, and this is you can give I think people have different answers and opinions about this matter. But if I would ask you that, can you be cured from, or maybe turn it the other way around, because I'm still dealing with some OCD related stuff. Can I be cured and other people from OCD, and how do you define that recovery?
Sure. No, it's a good question. And I think the question really hinges on, what does cure mean? Cure would mean that there's a problem, that there was something broken that needed to be fixed. And I think if we look at OCD, what is really broken? You can look at all the brain scan studies and all of that, and
Sure.
People say, oh, look, there's a difference in an OCD brain and a not OCD brain, and it's a whatever percent difference with this one region of this one part of the brain. And I generally tend to just have trouble with the idea that a whatever percent difference in your brain and mine can cripple somebody with OCD and leave somebody like me just running around free of OCD. So I tend to not think that there's this big problem in the brain that we need to fix or cure. And then we can look at OCD thoughts, right? Like, did I hurt somebody? Did I run over somebody with my car? Is this dirty? And am I going to get sick? And those are thoughts that everybody has. And pretty much everybody, not pretty much, absolutely, everybody will have at some point in their life, or even at some point in any given day, right? So the fact that you're having the thoughts doesn't mean that there's something broken or that needs to be fixed. I tend to think of OCD as like a trap that some people fall into. So when it comes to the word cure, I don't like to think about it as you're broken and then you're cured. I like to think about it as if you've fallen into a trap and then we help you out of the trap.
Sure.
And then when you're out of the trap, there's you may get caught in it again, you may not. But you're aware of the trap, you can move away from the trap and you can go live your life.
Yeah.
So I'll answer the question by not really answering the question.
No, it's good. And actually concept that I'm fascinated, that I've heard from a person who has been helping me out, or I can say his name, Mark Freeman, who's done a lot about on Facebook, Instagram, and social media and such. He mentioned that the view of OCD is not something you have, it's something you do, which I find fascinating in a sense, because then it gives a more empowering feeling about me. Actually, it's possible to change because it's something I do. It's a routine that I have, or ritual, what do you want to call it, and that can be changed. Yeah,
like a lot of other things. It's so interesting to me, the idea that we have all the textbooks and all of these things that say, okay, well, you have OCD and therefore you're kind of broken and you're going to be broken forever, but we can help you to learn to manage that. And I can't imagine like a less motivating way to start any process than to be told that I'm broken and I'm just going to have to like hobble these pieces together forever. It always rubs me the wrong way. So I just like the idea of it's something we're doing, something we've been tricked into, that we could choose to stop doing and get out of, and move on from.
Yeah, that's true. Yeah. So I already mentioned Bergen a bit, and I think most of the people who are following my YouTube and Instagram are at this point, because we're a group of people at the moment in the OCD Finland thing, which is really nice. But how would you define, or how would you differ if you look at Bergen and ACT and ERP and cognitive-based therapy? How do they differ from each other? In what sense?
Yes, I think there's a few differences. So there's a lot of things that are the same. The Bergen treatment is still exposure therapy. You know, some people would say, I want to do the Bergen treatment because I don't want to do exposures anymore. You're still doing exposures. You're still coming in. You still have to touch the toilet or whatever it is that you might have to do. There's a couple differences, and I think one of the big differences is in how you present OCD to people and how you present treatment to people. And you just heard me give a little bit of it, that kind of rationale right there, right? We're not necessarily broken. It's not something that you have to control forever. It's something that you do, that you can choose to do or not do. And let's talk about how to help you do that. So I think how we talk about OCD, how we talk about exposures is really, really different. And you know, one of the other, without getting into too many, I could talk about this for hours, but we don't have the time right now. But one of the big differences too is really how you do exposures. And the idea, one of the big ideas for the Bergen treatment is, if you're going to do it, let's really, really do it. You know, doing an exposure where you have half of a foot in the pool and the rest of your body is out here, you know, you might acclimate that little part of your foot, but the whole rest of your body is going to remain, you know, dry and terrified of the pool. It's about really getting into it, really choosing to make the jump, and being ready to take the jump when other therapies don't work that way. And that would lead me to one of the last big differences in the Bergen treatment, which is you get an entire day or multiple entire days with people. So the Bergen treatment is really for people who are ready and willing to jump in, to get ready, to get rid of their OCD, to move on from their OCD, however you would want to frame it. And to really take the time to say, we're going to do some exposures, but we're going to do them right. And we're going to see them all the way through. Instead of, you know, we have an hour here in my office, we spend 20 minutes saying hello, and then 20 minutes kind of doing something, but then we have to stop and we have to make a plan, and then you go, and then you can avoid OCD the whole rest of the week because I'm not next to you making you do it, right? And progress moves so slow when you do it that way. But when you say, hey, I'm going to be with you for a whole day, there's nothing you can do to avoid.
No, you're in that thing all the way. Yeah.
You get a lot of good work done in a much shorter time frame, which is so nice for people. Yeah.
How would you see about the Bergen model the whole COVID situation and so on is one discussion, but also getting treatment to people. I mean, COVID or not, I would probably not be sitting on your couch there or the
no,
stool behind you at this point. Yeah, that's true. So I mean, how do you see in the future? Could you see parts of the Bergen and parts of, I mean, the therapy you're doing, not just Bergen, but other stuff as well?
Absolutely.
Being possible to do like this online.
Absolutely. So
Yeah.
for us in America, we kind of stopped the Bergen program for a while during COVID because the Norwegians
Sure, yeah.
out. But the last I heard, some of the Norwegian team is doing that treatment still on telehealth. So I can't.
Okay, but that's, I mean, that's promising that they can. I mean, that's a good thing. Yeah.
Yes, and then like for us at our practice here, so at the McLean Institute, OCD Institute of Houston, we have a residential program. So our residents still come and still live here and are just coronavirus tested, and we wear the masks. But all of my other patients are over telehealth.
Okay.
And have been really since March. And there are a handful of people who kind of don't like it or who feel like they need somebody in person to help them. But a lot of people really, really like the telehealth. You know, it lets me get into their home, into their trigger zones, where I can see what's going on and see how they're doing exposures and help them do the exposures the right way and set up their rooms or houses in a way that the OCD wouldn't like. So I think the telehealth aspect has been really, really helpful for a lot of people. Really opened a lot of doors for people who maybe can't take the time off of work and drive to a clinic and do all of this. So I think it's been great, and I think we're going to retain a lot of telehealth, even if there were a vaccine tomorrow. I think we'd retain a lot of telehealth.
Yeah, and I mean, Finland is a small country, but still, if you look at look at the capital area, there might be treatment and therapies, but then you go, I don't know how, I don't know miles, but I'm just throwing something out. Let's say 300 or 400 miles up north, whatever that is, how long that is, and then treatment. I mean, then the understanding, the treatment, and all of that goes away.
Sure.
Like drastically. So.
Absolutely. Houston is a city of like 4 million people. It's this gigantic city. And if you're right in the heart of the city, which is where we are here, there's 5, 10, 15 good OCD therapists that really know OCD. But then as soon as you get even 20 kilometers, if I'm guessing about how far that is, even 20 kilometers out of the city center, you really don't have anybody that knows OCD well. And that's true for hours in any direction, really, until you hit another major city. So you have these huge swaths of land where there's no good OCD, or no OCD providers, period, not even like good OCD providers. And telehealth has been, I think, really, really helpful for those people as well.
Yeah. I was going to ask you about how do you see OCD treatment in the future, but maybe I would like to switch it around a bit and put it like this: How would you like to treat people with OCD in the future?
I can answer that question. I really like severe. I really like extreme cases. I just find it so rewarding and meaningful to take somebody who is so completely stuck, the OCD is completely just put the brakes on their life and help them open it up and move their life forward. And in order to really do good, effective treatment with a really severe case, you need an extended period of time with somebody. So that could be multiple hours a day, multiple weeks. That could be a handful of days, kind of full day treatment, similar to the Bergen treatment. But I think really having the time, really being able to like clear my schedule, and when coronavirus is around, be in somebody's home, go to somebody's environment and spend just a good amount of time with them is a really helpful way to work with OCD. And OCD is so manipulative. You can do one really nice exposure, and then you can leave your therapist's office, and 3 hours later, the OCD's kind of convinced you that it didn't matter, or it wasn't real, or this other thing's more important, right? Yeah. And then the whole system starts itself over again. And you can do that over and over and over and over and kind of get nowhere, get somewhere.
Yeah.
But when you have good condensed time with somebody, you can catch the OCD as it tries to make those shifts, and then redirect, and then keep moving forward. And if you can help somebody in those moments, I did a good exposure, but what about this? If you can fix that moment, that really seems to help people in their recovery for a long time.
Yeah, yeah. How would you
So
see? Sorry.
that's what I like to do. I'd like to just come to Finland and just bring my kids, and especially in the summertime in Texas, and just spend a few weeks working with OCD, and my kids can be outside for a minute.
Yeah, you are mostly. I mean, can you say that you are mostly welcome? He said mostly. No, that's not the right way to say it. But you got my message. I think what I meant.
Mostly welcome is as good as I get in America anyway, so I'll take it.
Mostly, yeah. But still, yeah, you are welcome here.
Well, I
yeah. Actually, regarding that, how do you see? I mean, because through my peer support and those things, I've been noticing. I mean, there's a lot of people. This is just not only in Finland or Sweden or up here, but in other countries and places. How do you see? Would you have any good things to say to people who live in a place? Or two factors: one, they don't have a therapist close by, and B, they don't have the money to get the proper treatment.
Yeah.
How would do you have any? I mean, that's a difficult subject to
give
an answer to, but
sure, especially in America.
Yeah.
It costs a lot of money.
Yeah.
A couple things. So one is there's a lot of people like you. If you have OCD, there's a lot of people like you that are out there that A, have found help and found relief, and B, would sometimes be willing to help you find relief too. So it sounds like that's exactly what you're doing in Finland, is trying to put together a group that would help provide support for people, but also connect them in with services.
Definitely, yeah.
So
to
important.
Kind of shorten the burden and also make things easier and quicker to get treatment.
Really, I mean, that's really important. OCD will get worse. OCD, for the vast majority of people, doesn't just kind of come up and then go away on its own without you doing anything about it. It takes a concerted effort. And a therapist, especially a therapist very knowledgeable about OCD, can make that effort shorter and faster and the relief more lasting. So there's people like you. You can find resources. I always hesitate with things on the internet. So I make some YouTube videos, which anybody could find if they typed my name in at any point here. And I make them because I think they're helpful, but I also understand that a video is a stagnant piece of information. Yeah. And somebody with OCD might come in and see the video, retain a skill, use the skill, and it might work. And then the OCD might shift, and the same video wouldn't work anymore, right? Because the OCD shifts around.
Sure.
So if that happens, there's good information out there for you on the internet and in books and things like that. And if the OCD shifts around, or you find some of the skills helpful on and off, that's okay. That's normal. See if you can pick up a new skill. See if you can pick up another book. See if you can find a therapist. Let yourself struggle sometimes. Let some days be hard. Let some days be easy. This isn't about finding the perfect skill that's going to work every time, all the time, no matter what. This is about kind of being a normal human who gets to be anxious sometimes, and gets to move on with their day sometimes, and gets to use some skills sometimes too.
Yeah.
So there's resources out there. And I'll also say anybody can email me at any point, and I will do my best to try to connect you in.
That's really nice to hear.
That could be helpful. Yeah. Yes. cbrant@houstonocd.org is my email. Or my website, drchadbrant.com. You can go there too. But I'm reasonably well connected, or at least connected to people who are connected, to find people resources, because really you shouldn't have to struggle with OCD as long as people struggle with it.
Yeah.
Know a good deal about what to do and how to help.
You can hear I met people who said that they've been struggling for 30 to 40 years, and and they've also had the sensation, which I understand, is that they have tried, they've gone through a therapist, they've gone to medication, this and that, but they never got this focused, like let's work with this. It's always something else, that you're basically just like really depressed or almost trying to end your life, or at that point. So the focus is on of course important things, but OCD is kind of the player who is not even on the field there.
I know. I always hate to hear it. One thing that's really interesting when I work with people very intensively for full days, One of the things I hear very often is actually anger. So people will do some really good work and we'll get over some of the road bumps and we'll work together for a day or two and they'll find a lot of relief, and then they'll start to get angry and they'll say, why doesn't everybody know about this? Why couldn't I have done this sooner? How come, there's not people offering this all over the place? And I think it's one of the weaknesses of the field is we have good treatments and we have good resources for people, but people don't know where to get it.
Yeah.
Which is just, it's just such a shame. And I hate to hear people have had OCD for years and years and years. But we can help. You can feel better. It can happen.
Yeah, and I know how important it is for people having your face there and other faces and voices to say that in a really quite, normal guy manner, not that you're sitting and evaluating or saying, okay, you are doomed forever, but you're talking about it. And I get the sensation myself from people who have that kind of attitude towards recovery and so on.
Yes,
so.
Absolutely. I'm normal, you're normal, we can both be normal and get over this and move on and do fun stuff in your life, right? That's okay. Oh, I will say, if anybody finds a therapist, there's like 2 or 3 questions I might recommend that you ask.
I was going to.
Perfect. Oh, good. It was in my head. So you must have put it there with some kind of magical OCD power. I think you planted
it. Magical stuff.
That's right. That's right. I thought it 3 times and then I thought it. You can ask a therapist if they know ERP. How experienced are you in ERP? Do you have any training in ERP? That is usually very, very helpful. You want a therapist who says, yes, I know ERP. I did this training. You don't want somebody who says, oh, yeah, I've heard of it. Or no, I don't really do that. I do something else. Exposure and response prevention is the most helpful thing for OCD. And another question you can ask a therapist is, what percentage of your cases are OCD cases?
That's a good one. That's a really good one.
Yes. So if somebody says, oh yeah, I see 30 cases a week and maybe 1 a week, I have an OCD patient. That person might be a great therapist. I don't want to disparage anybody, but that's not a specialist, right? Not somebody who's really specializing in OCD. So just at the clinic here, all the therapists here, I would guess that we see 80% OCD and the other 20% are related anxiety disorders.
In some ways,
Some of the depression that comes with it, like you mentioned, yes. That's just because I'm a specialist. And if somebody comes to me and they don't have OCD, they have something else, I send them away because I'm not good at other things. I'm good at OCD. So it's about finding the therapist who really knows OCD and the treatment and is ready to jump into it with you.
Yeah. I think you almost like the end question, you all more or less answered it, but turning things around and may also maybe doing some advertisement for your own podcast. You mentioned that we can switch if you're on my show, I will be on your show. So my last question would be, if we simulate like 2 months forward and you would like throw a question from the top of your head to me, what would that question be right now?
Oh, that's a good question.
And you can be really open. I mean, I'm
I'll hit you. Okay. Yeah. What's the most embarrassing thing you can say on YouTube? Okay. I think one question that people would find really interesting is somebody who's had OCD and worked with it and found relief. Where do you find the motivation? Where do you find the motivation on the bad days or in the bad intrusive thoughts to get in there and do the good exposure work, even though it's hard?
I think it's maybe not a quick fix because I don't think that's really possible in that moment. But something that I've learned through the peer support and some from therapy as well. But for some reason, this is kind of I think actually, if I think way back, this is something my grandmother told me, and it's not concerning OCD at all. But for example, if this is the worst shitty day you ever have, you don't know how it's going to look in 2 weeks. You don't have the control about that. It can be really bad, but it can be really good as well. So that's something I tried to remember, because if I look 2 weeks forward, there might be a lot of different things that I couldn't anticipate. So So putting myself like, okay, people are talking, I know mindfulness in a sense that, it's this moment is all you got, but in this sense, it can also be, there might be a lot of moments that I don't even know about yet. There might be in 2 weeks or 2 months or 6 months or.
Sure.
I mean, something that when I'm an old grandfather, hopefully, there might be something I don't know about. So that kind of thinking maybe has been one of the most important things for me to remember.
I like that a lot. Do you mind? You're making me think. Do you mind if I share mine as well here, since we're here?
No. Be my guest. You are my guest.
Yeah, that's right. Yes. I'll do what I want. So on a personal note for me, so my father passed away last year, actually, quite suddenly, and it was just awful. And one of the things that has stood out to me in time, speaking of time in the future from a terrible moment, you don't know what it's going to be. One of the things that consistently stands out to me is some version of, Chad, you could be dead. You could be dead tomorrow. This horrible thing could happen. And if something were to happen, if you were to get sick, if you were to die, how would you want your last day to be? Would you want your last day to be, oh, here's all the things I avoided, here's all the things I put off till tomorrow, here's all the things I said I would do later?
Chad the master to avoid things for 87 years. Yeah.
Yes. Or would you want the last day to be the day you made that phone call you didn't want to make, or the day you hugged your son, or, you can take that in a lot of different directions. And I find myself doing that over time. But I find myself, when I get anxious or stuck in moments, there's an element that's kind of similar there for me in terms of how I can find some motivation or some rationale or just something to get the gears moving again. And I know for me, as soon as I take that first step towards whatever it is that's making me uncomfortable, the rest of it tends to fall in line. I tend to act quickly, and I get taken care of things quickly, and they feel better. But the longer I wait, the harder it gets, and the farther back I pull. So it's interesting. It's interesting. We hadn't talked about this before, but there's this little...
Good stuff. Yeah. Any final words? Something that pops into your mind or something?
You can feel better.
Yeah.
It's out there for you. There are people that can help. I mean, you can reach out to me at any time. So I give my email and my website, drchadbrant.com, and you can send me a message through that too. And I can't offer to anything in particular to anybody like, I will respond, and I will try to be helpful, because you do deserve to feel better. Even if you don't believe me right now that you deserve to feel better, I really think you do deserve to feel better. So there are people out there to help, and I'm happy to help connect you.
Yeah. Thank you.
Absolutely. Such a pleasure.
I think we can slowly wrap things up, but it's been a really good time talking with you.
Good.
Easy to talk to you. It's an awesome thing. Yeah.
There's years and years of training. That's Well, you too. It was a pleasure. Thank you for having me.
Thank you.
I hope this is helpful for somebody in Finland or elsewhere. Yeah.
And if you want to come and chat once more, I have to get back to you. I have to be on your podcast and then after that maybe.
Yes, that would be lovely. That'd be fantastic.
Sure. All right. I was going to say something really. Yeah, I had to mention because when we started, before starting recording this, you noticed SpongeBob. So I have to tell you what his name is in Finnish. It's called Paavo Pesusieni. So it's basically Paavo SpongeBob. But because it's not Bob in Finnish, so he has to be Paavo then.
So, it's fantastic. You learn something every day.
Yeah, this is really OCD related stuff. So we can end it.
Things people need to know.
Sure. All right. But have a nice day, and let's talk to you soon, and keep up the good work.
Thank you very much. You too.
Thank you. Yeah, thank you. Bye-bye.